cerebrovascular accident is the rapid loss of brain function due to disturbances in the blood supply to the brain and is impaired by blockage or rupture of an artery to the brain. It is potentially deadly and can affect many parts of the body, such as the respiratory system, the nervous system, circulatory system, muscular system, digestive system, urinary system, and reproductive system. When it comes to the respiratory system, there will be damage to the brain that controls eating and swallowing. This is called dysphagia. A stroke that takes place in the brainstem where the body's vital functions, such as breathing, heartbeat, body temperature, are controlled, can cause breathing problems. The nervous system is made up of the brain, the spinal cord, and networks of nerves throughout the body. There will be more pain than normal or when regular activities are done in the areas of the body that weren't painful before the stroke, as the brain will no longer function as it used to, for it won't understand certain sensations. There can be changes in vision, foot drop, or paralysis. Some overlap between the areas of the brain and their function. A stroke is oftentimes caused by existing issues within the circulatory system that build up over time. If a stroke has occurred once, there is a high risk of having a second one or a heart attack. Messages won't be able to travel properly from the brain to the body's muscles. This can cause paralysis and muscle weakness. Weak muscles have trouble supporting the body, which tends to add to movement and balance problems, as well as feeling more tired than usual. As it relates to the digestive system, a stroke can affect part of the brain that controls the bowels, causing incontinence or loss of bowel function. Damage from a stroke can cause a breakdown in communication between the brain and the muscles that control your bladder. There might be a need to go to the bathroom more frequent, or the individual may urinate in their sleep or while coughing and laughing. A stroke does not directly affect how the reproductive system works, but can instead change the experience of sex and how one feels about their body. One issue that may arise is paralysis and depression.
My name is Nika-Lee and I will be presenting on the normal and altered physiology of the brain. The brain is supplied with blood by two major arteries, the internal carotid artery and the vertebral artery. The internal carotid artery supplies the anterior area of the brain with blood, while the vertebral artery supplies the posterior area of the brain with blood. The internal carotid and the vertebral artery branches off into smaller arteries to different areas of the brain, supplying brain tissues and cells with blood. Blood contains oxygen and nutrients which brain tissues need to function and to stay alive. Each area of the brain has a particular function. For example, the frontal lobe is responsible for speech, memory, thinking. The temporal lobe is responsible for hearing. The brainstem is responsible for respiration. So there are two types of stroke. You have ischemic stroke and hemorrhagic stroke. In ischemic stroke, there is a blockage of the artery or a stenosis of the artery. So a blockage in the artery causes inadequate blood to reach the brain tissues and cells, and over time they begin to die. This may be caused by an embolus or a thrombus. In a thrombotic stroke, a clot is formed in the atrial wall within the brain. This is seen in patients with hyperlipidemia. So this clot within the atrial wall causes the lumen of the blood vessel to narrow, right? Which results in the blockage of blood going to the brain tissues, causing them to die. In an embolic stroke, a blood clot is formed in a different area of the body, such as the heart. The blood clot travels to the brain where it lodges into the blood vessel, causing a blockage in the blood vessel, so the brain tissues are not getting enough blood, so the brain cells and tissues begin to die. This is seen in heart complications such as atrial fibrillation, in which blood pools in the upper chamber of the heart and results in the formation of a blood clot. In hemorrhagic stroke, there is a rupture of the blood vessel. This can occur in the subarachnoid space or the intercerebral of the brain. This is seen in patients with aneurysm, brain aneurysm, or uncontrollable hypertension. With a brain aneurysm, there's an enlargement or a bulging of the artery artery. Over time, the atrial wall becomes fragile, so the blood vessel ruptures. Blood leaks into the brain. Because there's no route of escape, the blood pools into the brain, adding pressure in the brain and causing the brain tissues to die. After a stroke, the normal function of the brain is altered. The brain doesn't function effectively like it did before. For example, if a stroke occurred on the right hemisphere of the brain, it alters the function of the left side of the body. And if a stroke occurs on the left hemisphere of the brain, it alters the right function of the body. Or for example, if a person had a stroke in the left frontal lobe of the brain, that person may develop aphasia, which is the inability to communicate. The frontal lobe deals with speech and communication. Or if the patient had a stroke that affects the brainstem, then the patient may develop problem breathing because the brainstem deals with respiration.
My name is Britney Wilson, and I'll be speaking to you today about the causes or causative agents of cerebrovascular accident, also known as stroke. Now, ischemic attack is the most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow or ischemia. Blocked or narrowed blood vessels are caused by fatty deposits that build up in blood vessels or by blood clots or other debris that travel through the bloodstream and lodge in the blood vessels in your brain. Hemorrhagic stroke occurs when blood vessels in your brain either leak or become ruptured. Brain hemorrhages can result from many conditions that affect your blood vessels. Factors related to hemorrhagic stroke include uncontrolled high blood pressure, overtreatment with blood thinners or anticoagulants, bulges at weak spots in your blood vessel walls or aneurysms, trauma such as a car accident, protein deposits in blood vessel walls that lead to weakness in the vessel wall, or cerebral amyloid angiopathy. Also, ischemic stroke leading to hemorrhage. Now, transient ischemic attack, or TIA, is sometimes known as a mini stroke. So it's a temporary period of symptoms that you experience that are similar to you having an actual stroke. So a TIA doesn't cause permanent damage, but they are caused by temporary decrease in blood supply to part of your brain, which may last as little as 5 minutes. But like an ischemic stroke, TIA occurs when a clot or debris reduce or block blood flow to parts of your nervous system. So you are to seek emergency care even when you think you've had a TIA because your symptoms got better. It's not possible to tell if you're having a stroke or a TIA based on your symptoms alone. If you've had a TIA, it means that you have a partially blocked or narrowed artery leading to your brain. Having a TIA increases your risk of having a full-blown stroke at a later date, and my colleague will speak about this in the
risk factors of cerebrovascular accident include diabetes, high blood pressure, high LDL cholesterol levels, smoking, brain aneurysms or arteriovenous malformations, which are poorly formed tangles of arteries and veins which break open in the brain, age, sex, viral infections or conditions that cause inflammation such as lupus or rheumatoid arthritis, race and ethnicity, family history or genetics, as well as anxiety, depression, and high stress.
Greetings to you, Miss. My name is Shay-Ann and I will be explaining the clinical manifestations of hemorrhagic strokes. There are two types of hemorrhagic strokes, intracranial hemorrhage and subarachnoid hemorrhage. So first, I'll be explaining the clinical manifestations that are associated with intracranial hemorrhage. One clinical manifestation of intracranial hemorrhage is headaches. At this point, it's important to note that while the brain itself does not have pain receptors, the surrounding outer membranes do. These outer membranes stretch as a result of the bleeding that occurs when a blood vessel bursts. The headache that results from the stretching is often described as the worst headache one can imagine. Consciousness may or may not be maintained with these headaches. Unconsciousness may result from increased intracranial pressure. When the blood vessel bursts, blood starts to build up, and since the skull is rigid and cannot expand, it puts pressure on the brain, thereby leading to the onset of unconsciousness. Also, the area of the brain that should have been supplied by this ruptured blood vessel will be starved of oxygen, which also contributes to unconsciousness. Now moving on to subarachnoid hemorrhage. This occurs when the ruptured blood vessel bleeds into the space between the brain and the tissues surrounding it. One manifestation that can be seen in subarachnoid hemorrhage is hemiparesis, which is weakness of one entire side of the body. If this hemorrhage occurs in the left side of the brain, your right side will experience hemiparesis and vice versa. As it relates to dysphagia, this may occur due to the damage of the cortex or stem of the brain. And lastly, red flag headaches are usually manifested with subarachnoid hemorrhages, and the mechanism is the same for headaches associated with intracranial.
There are other clinical manifestations of cerebrovascular accident that may occur, specifically with the ischemic stroke. The individual may have issues understanding others or issues speaking. Now, the site where the manifestation occurs depends on that brain area that would have been nourished by that now clogged blood vessel. So with the individual having trouble speaking, it would be those muscles that are responsible for movement of your tongue, lips, and that which controls your breathing. When those muscles are damaged, then you would find the individual having issues communicating with others, speaking as they would. Another manifestation would be paralysis of the legs, face, or arm. Now, what you would notice happening is that when the right side of the brain is affected, then the left side of the body would be paralyzed or would be numb. And then if the left side, the same goes for the left side, left hemisphere of your brain, if that is affected, then you would realize that the paralysis occurs on the right side of your body. Now, the individual with a stroke may also have issues with seeing. Now, when the brain stem is being damaged or affected by the stroke, then you would realize that the individual may have double vision, may have blurred vision, may not be able to see clearly. The individual may also have headache, and they may also have trouble walking around. And what happens is that part of your brain that is responsible for muscle coordination, when that is affected, then you would realize that your body and your mind are not working together so well, and so the individual will have problems with moving around as
my name is Taherah English, and I will be presenting on the general management of cerebrovascular accident. The general management of a stroke after occurrence includes controlling blood pressure, hyper or hypoglycemia, and body temperature, ensuring pulmonic and cardiac care, along with restoring the loss of fluids and ions, maintaining metabolic processes, preventing pressure sores and hypoxia, treating elevated intracranial pressure, dieting and exercising. In addition, pharmacological management such as antiplatelets and anticoagulants are used to control and treat cerebrovascular accidents. Aspirin as an antiplatelet medication is used to reduce pain and inflammation, while paraffin as an anticoagulant can significantly reduce the risk of recurring stroke, as it is used to treat blood clots. Statins such as pravastatin is also used to significantly reduce the incidence of stroke in patients with a history of heart disease, along with lowering cholesterol levels.
I'm Beckett, and I'll be telling you about prevention and risk reduction. The goal of stroke prevention is to avoid or decrease stroke incidence. In an aim to reduce the risk factors present, individuals should be advised to monitor and control their blood pressure, glucose, and cholesterol levels. This can be done by keeping up to date on all medications. For example, antihypertensive medications, antiplatelet medications like aspirin, anticoagulants like warfarin, insulin, and other diabetes medications, and by making lifestyle changes. This is very important, as in hypertensive individuals, the pressure within the arteries are consistently exceeding normal or healthy ranges, and as a result of this, the walls of the blood vessels become damaged, which can lead to particularly a hemorrhagic stroke. In response to high blood pressure, the artery walls may also thicken and narrow, which can lead to a blocked blood vessel and an ischemic stroke. Diabetics should be educated that high blood glucose levels contribute to arteriosclerosis, which encourages the development of clots. Excess cholesterol in the blood encourages coagulation and atheroma. Atheroma is a substance that sticks to vessel walls and hardens and narrows it. At-risk demographics should also be advised to avoid heavy drinking, smoking, a diet high in sodium, sugar, fats, and cholesterol, and a diet low in fruits, vegetables, and grains. Alcohol abuse can put you at risk for hypertension and arrhythmia.
Smoking can increase blood pressure, decrease oxygen carrying capacity of cells, increase triglyceride levels, lower HDL, make blood sticky and more likely to clot, increase the likelihood of plaque buildup, thicken and narrow blood vessel walls. Unhealthy eating can also increase the probability of clogged arteries and high blood pressure. Individuals should be educated on a balanced diet with lots of fruits and vegetables. And they should also consume lean proteins and foods high in fiber. In addition to diet, at-risk groups should be cautioned not to maintain a sedentary lifestyle or a high BMI. Persons should exercise regularly, at least 30 minutes a day, and try to maintain a healthy weight for their gender, age, and height. Obesity and inactivity are associated with hypertension, diabetes, and many heart diseases. Preservation of function. After a stroke, the goal is to preserve and restore function, return independence, and avoid another stroke incident. Rehabilitation post-stroke may depend on the severity, location, degree of tissue damage, cause, prior and overall health, and family support. Patients may experience deficits in motor skills, language, sensation, cognition, and may need adaptive tools and an altered environment. This may include multiple health specialists, some of which include physicians, nurses, neurologists, physical, speech, and occupational therapists, and a dietitian. Mobility training may be offered to adapt to or correct disturbances in balance, coordination, and movement control in any part of the body. Physical and occupational therapists may train the patient in transferring from one area to a mobility tool. For example, they may teach the patient how to move from the bedside to a wheelchair, or from their wheelchair to a bath. May also be trained in how to position themselves and use a wheelchair to reduce the risk of pressure ulcers and other injuries. They may also be trained in how to walk using other mobility devices such as canes, braces, walkers, and splints. After an evaluation, patients may be offered driver rehabilitation. This includes training in adaptive vehicles that will promote independent driving. Speech, language, and cognitive training may be offered to improve communication. Therapists may also intervene with specialized feeding and swallowing plans to address dysphagia, aspiration, and nutritional needs. Patients may be limited to a certain position to facilitate eating or receive a specialized diet. Patients may also learn new swallowing techniques and swallowing exercises. Self-care training will teach patients new ways of doing daily activities. The goal is for patients to perform personal care tasks such as feeding themselves, bathing, grooming, toileting, and dressing themselves. Patients may also learn adaptive ways of meal preparation, household tasks, and community participation. They may also be taught how to administer their own medication. In addition to these therapies, preservation of patient function may include stroke medication and medications for other health conditions. For example, hypertensive medication, seizure medication, insulin and other diabetic medications, antiplatelet medications like aspirin, and anticoagulants like warfarin. Patients will also have to be very aggressive with lifestyle changes to reduce the risk of another stroke.